Good day to all of us. Mayong adlaw ng atong tanan. Karong adlaw, Marso 15, tuig 2020, ang atong kagamhanan sa Kabayan sa Cebu mag-issue ning bag-o na Executive Order number 052 nga atong i-caption of an order declaring a state of general community quarantine in the city of Cebu and providing guidelines thereto. Uban ka na ako karon dinhi niya ang atong City Health Officer, si Dr. D. Sevilla, niasad si Konsihal Philip Safra, niasad si Attorney General Castillo, ang atong Special Assistant on Financial Matters, niasad si Councilor Dave Tumulak, isang adlaw Domingo, niasad si Councilor Raymond Garcia, niasad ang atong usa ka konsyal, si Councilor Dave Tumulak, niasad ang atong City Legal Officer, si City Attorney Attorney Ray Jalon, of course, ang atong konsyal usap na si Konsyal Edu Rama, usap si Attorney Floro Casas, o ang atong nailhan na kayo nga panday, the last but not least, si Konsyal Joel Garganera. Ang yato dito ang atong DSWS, si Dr. Ray Ibones, kay mga mga pangutana, may tungod po medical science, may mong siya ituan. Kaya hindi man sa doktor, pero man ta, diya naasa diha si Atty. Maratas, ang atong Department of General Services. Niasad si Atty. Maru sa Ratira, ang atong Assistant City Administrator. Ako lang sigurong i-spell out, basahon lang nako, kay this is an executive order. It has the force and effect of a law and guideline of the City of Cebu. Mahitungod din atong pagdeklara o General Community Quarantine. General Community Quarantine gani, murag ato ni i-upgrade, no? Na ang mga tao, kuha dito ang atong City Budget Officer, si Mayor Comia, na as much as possible, ang atong mga kaigsuunan ng mga lumbulog dito, to please, we advise them to stay home unless there is a very important and compelling reason for them to stay out. Like for example, suot sa trabaho, doon ay mga medical na mga kinahanglan. Kanya ato na sang nilimit ang atong coverage sa mga business establishments. Kami pag din ng mga establishments na magpundo o ubay-ubay ng mga tao. Gani, ato mga nakita, we comply with the social distancing required. 1 meter siguro ni mga opisyalis din sa kaya. Of course, ang ato na lang sigurong idritso, ang ato na lang guidelines, tanan lang yun, no? O sige. Whereas Section 15 of Article 2 of the 1987 Philippine Constitution provides that the states shall protect and promote the right of the people and still health consciousness among them. Whereas on January 7, 2020, Chinese health authorities reported that the cause of a viral pneumonia outbreak in the city of Wuhan, Hubei province, China, was a novel type of coronavirus that has not been previously identified in humans. Whereas on March 7, 2020, the first case of localized COVID-19 transmission was confirmed by the Department of Health. Whereas on March 8, 2020, President Rodrigo Roa Duterte, recognizing that the COVID-19 public health event constitutes a threat to national security and to prompt a whole-of-government approach in addressing the COVID-19 outbreak, declared a state of public health emergency throughout the entire Philippines through Proclamation number 922. Whereas the World Health Organization has already characterized the COVID-19 as pandemic. Pandemic ka na extend sa spread, no? Worldwide na. Whereas the Department of Health has already reported a total of 111 confirmed cases and 9 deaths due to the COVID-19 in the country as of March 15, 2020. Whereas the city government of Cebu sees the need to put the city under a community quarantine to intensify the precautionary and safety measures of the city against the COVID-19 virus. Now, therefore, I, Ricardo C. Labella, City Mayor of the City of Cebu, by virtue of the powers vested in me by law, do hereby order. Number 1, Section 1, Declaration of Community Quarantine a state of general community quarantine is hereby declared and implemented in the city of Cebu from 12:01 a.m. of March 16, 2020 to 11:59 p.m. of April 14, 2020. Section 2, Community Quarantine Guidelines. For the period of March 16, 2020 to April 14, 2020, the following guidelines shall be observed in the city of Cebu. Number 1, Cebu City residents are strongly advised to stay in their homes and may only come out for work to buy food, medicines, and necessary supplies, and to go to medical centers. No one should be in the malls, community centers, commercial areas, and other public areas if they do not have any important transactions, business, or otherwise. Number 2, government work shall not be disrupted. However, government agencies operating within Cebu City are encouraged to provide alternative work arrangements pursuant to the Civil Service Commission Memorandum Circular Number 7, Series of 2020. On this regard, I have already instructed the City Administrator and Human Resource Development, Ms. Dayan Ortiz, to formulate a guideline that we could comply the Civil Service Circular, which provides that if even we reduce the number of hours that our employees work, they should at least work 40 hours in a week. Number 3, all malls, recreational centers, community centers, and such other commercial areas are directed to limit their daily operational hours to 8 in the evening, alas 8 sa gabi, except medical centers and pharmacies and other healthcare establishments. Sa ato pa, ang atong mga malls, mga kalingawan, recreational centers, putubra sa alas 8 sa gabi. All private establishments are mandated to have temperatures and scanning devices at all entry points in their premises and should ensure that hand soaps are available in the restrooms and that hand sanitizers and or alcohol are readily accessible. All mass gatherings, including but not limited to concerts, cockpit operations, fiesta celebrations, private or publicly led, are hereby declared, are hereby cancelled and or postponed. Number 6, the suspension of classes in both public and private educational institutions in all levels is extended until April 14, 2020. Sa atong usa ka executive order, it was only up to March 28, karon extended April 14, 2020, when we declare a community quarantine system set up. All educational institutions are to implement distance learning and provide home assignments and projects to all students to continue the fulfillment of their educational requirements. Number 7, all private establishments are strongly encouraged to adopt flexible work arrangements pursuant to Dole Labor Advisory Number 9, Series of 2020, dated March 4, 2020. Number 8, seaports within the jurisdiction of the city government are hereby declared closed to passenger arrivals except for cargo deliveries of essential goods. However, those who are already in transit upon the effectivity of this executive order will be allowed to dock but shall be subjected to quarantine protocols as prescribed by the Department of Health. Number 9, public transportation within the city is still allowed subject to the observation of the Department of Transportation guidelines on social distancing and community quarantine. 1 seat apart and passenger occupancy should not be more than half of the capacity of the vehicle, including the driver. The city government shall implement a 9-hour curfew policy from 8 in the evening to 5 in the morning during the entire period of community quarantine. Number 11, health checkpoints shall be installed in all entry points in the city with the assistance of the Philippine National Police and the Armed Forces of the Philippines. Number 12, hospitals and medical establishments are directed to oblige all their health workers to wear proper protective equipment. Employees handling cadavers are likewise mandated to observe strict protocols on wearing protective equipment. Number 13, residents are to expect temporary closures of the road as the necessity and conditions require. Number 14, all barangays are instructed to conduct house-to-house monitoring of individuals, particularly documenting pregnant women, sick individuals, senior citizens, and children under 10 years old. Number 15, the city government reserves the right to establish first response areas in certain barangay clusters. Section 3, effectivity, this executive order shall take effect immediately upon the signing thereof and shall remain effective until otherwise earlier revoked. Now, Section 4, sunset clause, this executive order shall be deemed automatically lifted, revoked, effective 11:59 p.m. of April 14, 2020, unless extended should the circumstances and conditions warrant. Done in the city of Cebu, this 15th day of March in the year 2020. Signed.
Sir, what is the nagantan mga viewers? Nag-evoke sila. So, kapag we have 3,500 viewers na, what's the difference sa community quarantine and a lockdown?
Well, of course, community quarantine, as distinguished from a lockdown. In community quarantine, this is more of a general quarantine. In lockdown, this is like a upgraded or a graver kind of quarantine. This because in a community quarantine, people are still allowed to work, go to school. Some buildings or some malls, offices are still open, but on a limited basis. But if it is a lockdown, there is a total closure of these establishments. Muna diferensya sa community quarantine. There's another term, upscale quarantine. That is the enhanced quarantine. That is the lockdown.
Sir, what will happen for those reconciliations, like masses or other gatherings? For those who will pursue the gatherings, what will happen?
Well, of course, as pointed out in this executive order, that will be assisted by the Philippine National Police and the Armed Forces of the Philippines. This is in pursuant to the general welfare provision of the local government law and, of course, the Constitution to promote general welfare, to protect the health and well-being of the citizens. That is why, in fact, we have already here members of the police force who are willing and ready. There will be checkpoints that will be in place during the activity.
Ano sa itong mga entrance and exit points?
But of course, because this is just a general community quarantine, if they can satisfy or ilang ipakita nga sila mo trabaho, eskwela, mo trabaho o doon ay importante yun kayo ng mga buluhaton, hindi allowed as distinguished from a total lockdown.
What's ilang ipakita Mayor for the
mga ID or ID sa trabaho or siguro kung makita sa mga Philippine National Police na tininuod yun na ang ilang pag-anha sa mga lugar o pagsuot sa atong mga malls for whatever good purpose. Okay.
Mayor, there's the requirements of the IATF that is stipulated there that when you declare a community quarantine, there should be a positive COVID case. Do we have a positive COVID case?
We do not have yet a confirmed positive case. But, you know, it is better to be preemptive, precautionary, rather than reactionary and reactive. We have some persons who can get monitoring na naman na. No? So, we have to be POI, persons under investigation. So it's better to be preventive, precautionary, rather than just reactive or reactionary. We will not wait any longer. We have to be preemptive and we have to be proactive.
What triggered, Mayor, to upgrade our preparation?
Because as we see in the reports all over the world, dili lang sa dinhi, ang mura man o wa kayo ma-contain. So let us not wait for something or more cases na mahitabo na to big. So we better have a community quarantine.
Does the executive order of Gov Garcia, Mayor, also couple the
yeah, of
executive
course.
order?
Ato sang gisuportahan.
Mayor, do we have, aside from the PUIs, do we have, are we seeing patient ba under investigation or
Dili na lang dito magbuwat nga naay mag-confirm. Tungod sa atong madungog, makita sa mga balita, dili lang dinhi sa atong nasod, bisan sa tibuok kalibutan. O doon na sa tayo mga kasilinganan ng mga local governments, no? Dili ra balayo, no? Nanay Negros, nanay Magiti, so dili ta magbuwat nga kanang maabtan ta dinhi. As I said, let us be preemptive, precautionary, rather than reactive.
Mayor, there are,
May gingon, an ounce of prevention is better than a pound of cure.
Mayor, there are reports that there's a PUI in Cebu City that already died. Can you confirm?
Yeah, doon ay reports niya na, but it has not yet been confirmed. We need a medical confirmation of that. Ani amang si Harold Alconte mo ng mga disaster. Wa pa din na confirm.
Confirmation on what, Mayor? Confirmation.
Confirmation nga kanang confirm positive.
So,
Wala
but,
pa din.
but he is a, or he or she is a PUI.
Doon ay mga PUI. Doon na natin.
The one who
But the
The one
one
who died.
he died,
Mayong, ang patubago na po ano, ang atong doctor of medicine. Unsa may prognosis, unsa may nabutang sa piling kuan. Kanang nangutan na naman sila, may tungo Dr. Villa, aning kuan.
Actually, this patient actually has been admitted in February 4 to 23 for TB meningitis. So, pagka March 10, naa siya ay fever, I think, na siya cough, difficulty breathing, so we admitted. We all know that TB meningitis is not that easy to resolve. So it takes mga 6 months para ma-resolve. So, trabaho siya, then na-admitted siya, re-admitted siya March 10. March 10, so I think kuhaan siya swab o niya 12 niya until karon wala pa ta makakuha o confirm na result. So ang iyang ikamatyan actually is severe pneumonia cases, then acute respiratory disease, but still wala pa tayo confirmation so this is actually a positive case. So we will wait for that result.
But he,
Or he is a PUI.
He is considered PUI.
does he have any travel or?
No history of travel.
Why he
How
is
old?
considered PUI? For what?
I think there is a close contact with other patient. I think,
Can you tell us a little background on the patient, ma'am?
huh?
A little background on the patient, ma'am. A resident of Cebu City, a foreigner, a local.
Resident of Cebu City.
How old is
27.
Is it male, ma'am? Male, female.
Female.
She female. Kung saan na supposedly mabawas ang
I'm waiting. They are still contacting the RITM. Until now.
Kasi siya namatay, ma'am.
Kaya,
Mga
What
what?
time is this afternoon?
This afternoon?
morning.
Morning.
Ma'am, pinaka-mabiyay sa itong monitor sa CCMC as of now.
Cebu City actually wala tayo admitted, but there are PUIs na we admit, but that's besides sa protocol natin
So,
tayo.
outside sa katong countries
Pero
covered by the travel ban.
Pero when you consider natay PUIs na even katong country nga wala giban, mo na atong i-debate sa protocol atong i-admit.
On the, with regards sa kanang test results, we sent it to where, ma'am? To RITM?
Yes.
Does the travel ban and the lockdown of Manila affect the kuan?
outside?
The pag-send sa kuan results? I mean sa test, swab test.
Wala man siguro.
Ma'am, paano saan siya na under person under investigation? Paano saan siya na atong i-investigaran na PUI siya?
Pero mag-admit niya sa
When?
March 10.
March 10.
Kaya actually, sa kapagingon, admitted siya because of TB meningitis. And that disease alone is really kanang long ang iyang pag-ayo. No?
Re-admitted siya, March.
Re-admitted. Because of, again, severe pneumonia, I think pneumonia.
But she is showing symptoms of the same as with COVID.
Pneumonia shows symptoms.
Oh.
When you have pneumonia, of course, you have fever, you have cough, you have common colds.
So it's the same with COVID.
Respiratory infection. So that doesn't mean na kung naapaan na nga sakit, diretso na gyud ka o COVID infection. So, galing lang, that is why we need to wait for the confirmation.
Dok, ito magahapon na TUI na ito sa Manila. Ito mga 38 po.
38, considered siya of PUI because of the fever na 38.4 niya coming from Manila. So, it was endorsed in the province.
Taga-Tabukon po.
Yes.
How about itong mga nagpuyog siya?
They actually instructed, we have I think 36 of that total number of passengers were coming from Cebu City and they are now considered as PUI.
Okay na?
Mayor, kung nag-close na sa ito abang mga ports, how about sa kanila sa Cebu Southwest Terminal at sa North, meron sa Mandawi? What
Actually,
will happen?
doon na tayo mga checkpoints na unya diha.
So,
Okay, para po nato, this is not an enhanced community quarantine. This is just a general community quarantine. We still allow, basta doon na sila yung mapakita ang rason nga ngano nga musod sila dili ay trabaho o na importante po yun.
Valid purpose.
Valid purpose.
Mayor, does the death of that PUI triggered or a factor of why you declared a community
Well,
quarantine?
actually, wa pa magunay confirmation. But of course, ako sa ginasad sa atong mga giuna-una nga, as I've said, we should always be proactive, we should be precautionary. Di ta maghuwat nga naay mahitabo, no? Kay duda man to, no? Pero wa pa lay confirmation. So dili ta maghuwat nga dunay confirmation. Let's nip in the bud. Unay gingon, an ounce of prevention is better than a pound of cure.
Mayor, speaking of proactive, are we also starting to contact the people na nakilubilo atong
Of course, that's part of it. Contact
Contact
tracing.
tracing is
Contact tracing, that's one. Oh. It's ongoing.
ongoing?
Ongoing na ang contact tracing. Ibisan o wa pa ikuan, wa pa confirmation, ongoing na ang contact tracing. Any influenza. Contact tracing is ato na nang gihimong yun.
How about the hospital where she was admitted, Mayor? How about the hospital that she was
Of
admitted?
course, no? Sa hospital na. Hindi na tayo. Basta it's being sought for confirmation. And of course, the procedure of contact tracing is a must. That is a logical consequence of contact tracing.
Asa siya kapuyod there is Asa siya kapuyod?
Si Dr. William siguro, wako kibaw.
Asa siya kapuyod? Sa Cebu City.
South District?
Sakto na, siguro. Okay na. Sige, thank you. Thank you.
Thank you, Mayor.
Uy!